Dr. Mark Woodall from Cascade Integrative Medicine, and today we're going to continue our series, Part 3, on fighting fatigue. Part 1 we talked about exercise. Part 2 we talked about hydrotherapy, stimulating motivation and blood flow as a kind of pre-warm-up to your exercise. Today I want to talk about a deal breaker though. And a deal breaker is, if this is present, it has to be addressed first before anything else is addressed. And one of the deal breakers in fatigue is anemia, iron deficiency. Now, you don't have to be anemic, which means your red blood cell production has dropped. You can also just be iron deficient, because iron isn't just in your red blood cells. It's also in your mitochondria, which we talked about in Part 1 of fighting fatigue. Now, this is a really big problem for a lot of my female patients. They lose blood every month. In that blood is iron. So they are naturally going to be more prone to low iron stores. But here's the problem. When you lose iron, you're more likely to have heavier periods, and so you bleed more and lose more iron. You can see how this is a vicious cycle. So we need iron to stop these heavy cycles and get their mitochondria and their red blood cell production normalized. I would highly encourage every female who's dealing with fatigue to go seek out a naturopathic doctor. You can schedule an appointment with me if you live in King County or on Skype, and get your blood drawn for a ferritin draw so that we can properly interpret your levels. Just because you have a normal ferritin doesn't mean your iron stores are adequate. The range for most labs is 6 to 140. Up to 400. And so, depending on if you're a male or a female. And so knowing where a healthy range is for ferritin for a woman and for a man is extremely important. I'm Dr. Mark Woodall. I hope you've enjoyed these segments. Please consider subscribing to my YouTube channel, tweet this message to your friends, share it on Facebook, and feel free to schedule an appointment with me. Be well.